Well, the World Health Organization recommended this week that people delay routine dental procedures until after the pandemic. The group says it is because dentists work in close proximity to patients' faces for long periods of time, and they are exposed to saliva and blood. However, the American Dental Association is now pushing back on that recommendation, saying with PPE, dentists can safely work. Dr. Jen Ashton joins us now to talk much more about this. I got to say, Jen, this recommendation kind of gave me some pause. I've been to the dentist. I've got an orthodontist appointment tomorrow for one of my kids. You know, I think a lot of people and parents are wondering, like, what are we supposed to do now?
Well, I agree with you, Liz, and this is controversial for sure, and I'm right there with you. I took advantage of the low rates that we're seeing right now in the tri-state area to go not once, but twice to my dentist in the last month because oral health is critical. You're right, the American Dental Association has issued a swift response, respectfully but forcefully disagreeing with the World Health Organization's recommendations that routine or elective dental work be postponed until the end of the pandemic. We have no idea when that will be. And I want to be crystal clear. The risk in this setting is really to the dentist and the hygienist, not to the patient. And dentists and hygienists have been so accustomed to maximum protection for decades. They've redoubled their efforts in the setting of COVID-19. But again, this is just, I think, causing a lot of people to shake their heads.
And I think there's a little bit of comfort taking, you know, in our area, we're lucky where positivity rates are still relatively low, whereas in other parts of the country, you might want to rethink it. What are your thoughts about that?
I think that that's appropriate for any elective activity, but that is why in this area we have to take advantage of these low rates that we are experiencing right now due to all of our hard work. And if you're going to be able to make your annual or semi-annual or triannual, as my dentist likes to encourage me to do, appointment, do it now, because skipping dental care is not good for our overall health. The American Dental Association and the World Health Organization, Liz, reminding people that dental caries in permanent teeth is the most common condition affecting human beings. So that's why I really can't agree with the recommendation, especially in the setting of low rates right now. If our rates were sky high, that would be a different story.
Right. Seize the opportunity while our rates are low. All right, Jen, thank you for clearing this up. We will be going to the orthodontist tomorrow. Appreciate it.
Good. You've got the green light.
Exactly.